Thank you for being here tonight.
In light of everything we've been through this year, it means even more that you've all joined us for this virtual 2020 event. We know this pandemic has been especially trying on healthcare providers, patients, and their families. For all of us, this year has been one to reflect on all that we often take for granted, especially our ability to be together and our overall wellness. The purpose of this event is to bring awareness to the role music can play in our health and wellness. Our time in quarantine has challenged not only our physical, but also our emotional and mental health. Music, as we will explore here, can offer peace and healing to our minds and bodies. Ms. Janice Spisso is the president of UCLA Health, CEO of the UCLA Hospital System, and Associate Vice Chancellor of UCLA Health Sciences. She's nationally recognized academic healthcare leader with more than 30 years of experience, and she oversees all operations of UCLA's hospitals and clinics, as well as the health system's regional outreach strategy. Ms. Spisso is a community leader whose work is focused on advancing biomedical science and improving patient well-being. She's received numerous awards and recognition throughout her career and was most recently named one of modern healthcare's top 25 most influential women leaders in 2019.
Welcome and happy holidays to all. We all know that the COVID-19 pandemic has affected the health of millions of people in the last year, including our patients, their families, and healthcare providers. However, the psychosocial burden of COVID-19 pandemic traveled far beyond the extent of the virus's physical spread, which cannot be measured by numbers and parameters. With the arrival of the COVID-19 vaccine last week, there is definitely hope on the horizon. The music and its healing power has been used since ancient time of human's life to improve the wellness. The Music and Medicine virtual event is a New Year's gift from UCLA Music and Kidney Program to our community. I wish to extend our gratitude to the healthcare providers and wish you all a happier and healthy 2021 during this unprecedented time.
Dr. Nilüfer Nobacht is the director of the Music and Kidney Program. A second-generation nephrologist, she was raised in a family that was passionate about treating kidney disease. She trained at UCLA and is now using her knowledge to give back to the community she loves. She's the founder of the Music and Kidney Program and believes in the benefits of music on human health and hopes to bridge the gap between music and medicine. She organized this amazing virtual event, calling together nationally recognized expert scientists and clinicians. It's my honor to present to you the powerhouse of a woman who's the visionary leader behind this event.
Thanks, Mariam, for the kind introduction. The idea of Music and Kidney Program came to us a few years ago when my pianist friend Safa helped us with a beautiful classical piano concert at UCLA Schoenberg Hall to raise kidney disease awareness to our patient and community. As a kidney doctor, I'm highly motivated to bridge the gap between music and medicine. We have been coordinating this event virtually, and we are honored to have distinguished guest speakers from UCLA Neuroscience, Psychiatry, Wellness, and Core Kidney Nephrology program. We also have International Association of Music and Medicine president with us this time. I'm positive you will be enjoying these beautiful pieces of music today. And I want you to know that this event is dedicated to all patients, healthcare providers, their families, and our community, to everyone who is navigating this global pandemic health crisis. Enjoy.
The program's pianist and composer, Safa Shahidi, is known as an extraordinary pianist and music composer. He performed for the 2018 Music and Kidney event at UCLA's Schoenberg Hall, touching all of our hearts and minds. Safa will bring 4 beautiful pieces here, for which we're extremely grateful.
Hi, I'm Safa. I'm a pianist and composer, and I have the pleasure to be part of the UCLA Core Kidney Music program as a musician. In this program, specialists talk about the effect of music on health, body, and mind, so we can better understand how good music can positively affect us. During this pandemic that we have to keep our distances, we all need music more than ever. Listening to music, sharing music, and especially playing music can keep us all close together, even from distances. So I invite you to listen to some pieces of music in different styles. And I also invited one of my very good friends, Aydin, who is a professional cellist, to join me and play a very beautiful tune for us. I hope you enjoy it. Take care and be safe.
Thank you, Safa, for playing La Bohème, the signature song of the famous Armenian French singer Charles Aznavour. Dr. Kamgar trained and works as a nephrologist and is the director of the Nephrology Fellowship Program at UCLA. He's one of the generous co-sponsors of this event. I'm personally grateful that he chose to become a nephrologist. When my father was diagnosed with end-stage kidney disease, he was referred to Dr. Kamgar. That was the start of our friendship. He treated our family with compassion and warmth that only genuine friends would. He provided my father with the highest level of care. His knowledge, expertise, and command of his field are truly exceptional. But what's even more exceptional is his depth of care and dedication to each of his patients. Unfortunately, my father lost his battle to kidney disease, but he was a believer in early diagnosis and hopeful that with advances in medicine, the next generations would not. I got involved with this program 2 years ago in honor of Dr. Kamgar, and it is with pride that I introduce him.
Thank you, Mariam, for your kind introduction. I should mention that your father was an exceptional human being, and it was my privilege to be his doctor. Here, I want to say hi to everyone who's watching this program, and thank you for joining us. As a person who's working with healthcare providers and as an educator who's directly involved with training physicians, I have witnessed the heavy burden that this pandemic imposed not only on our patient, but also upon the shoulder of the healthcare provider. Music has been an essential and quite effective tool that humans use for centuries to fight with stress. And these days, more than any time, we have to take advantage of this tool to fight with the psychological stress that this pandemic has brought to us. We had our first music and kidney program live at UCLA Schoenberg Hall in 2018. With everything that's going on this year, we thought to put this program together again, this time virtually, to point out the importance of well-being and dedicate this not only to our patient, but also to our frontliner in the battle with COVID-19. Thank you for listening, and I hope you enjoy the rest of the program.
Dr. Robert Bilder is a professor of psychiatry and psychology at UCLA. With more than 30 years of experience in research using clinical neuropsychology, neuroimaging, and genetic strategies to understand neuropsychiatric disorders. He has received numerous awards for his research contributions. His work has been presented in more than 200 publications and 500 scientific presentations. He directs the Tenenbaum Center for the Biology of Creativity and co-leads the MindWell program of the Semel Healthy Campus Initiative at UCLA.
Thank you so much for inviting me to participate in this amazing session. I'm happy to speak to you briefly about music, mind, and medicine, something that I hope will go along well as an appetizer to the event that you're about to experience. I'm really lucky to be able to study creativity at the Jane and Terry Semel Institute for Neuroscience and Human Behavior at UCLA, and also to enjoy the support from the National Endowment for the Arts, who have established a research lab at UCLA so that we can study the impact of music on the mind and well-being. And that's what I'd like to talk to you a little bit about for the next few minutes. But I couldn't persuade you if I didn't have some colorful images of the human brain. So this picture illustrates to you what I think is really one of the landmark studies of creativity, which was done by a great colleague, Charles Lim, who did brain imaging of people who are great jazz musicians while they're improvising versus while they're playing scales. And here, the goal of the study is to isolate those bits of the brain that are participating, the networks of the brain that come alive when we're improvising on music and performing creative acts with music. But I just show you colorful pictures of the brain so that you'll believe me. What I really want to talk about is how do we get to the point where we would enjoy music? How did music actually evolve in the brain? And that's where these little birdies come in. We've been able to do a lot of good research at UCLA, and particularly Stephanie White and her lab have done these amazing studies of zebra finches who sing in order to attract mates. Not only do they have to be good looking, like the little fella here on the right, who's so colorful and gorgeous, but they have to be able to sing. And young adolescent males have to sing to attract a female. And this is one of the evolutionary roots of music is to be able to use our tunes to attract members of the opposite species. But we believe that music probably has broader significance, and a lot of it has to do with our connections to each other. And so the next slide that gives some ideas about the evolution of music in humans, where we can identify territorial signals that were used in early tribes to try to figure out how we could best defend each other in a collective group. Also, if we work together, we can make quite an intimidating display out of our noise. These rhythmic signals also may be linked to walking and help to synchronize the members of a group. So for example, if we are out hunting together, if we step together softly, the other animals may not hear us sneaking up on them. Also, if we're trying to get away from other animals that are trying to eat us, we might be able to synchronize ourselves so they don't hear us in the same way that they would other animals out in the wild. As our societies matured, I think music has underlied a whole sense of social cohesion and communication that multiple listeners can enjoy at the same time. And I think that we get a lot out of this ability to resonate together to exactly the same musical elements as they come to us in these beautiful sequences. I'd already mentioned how we can also attract mates via song. The components of creativity that have to do with improvisation in music and expression of emotions through music. And there may be other elements. For example, the communications that exist between mothers and their infants may also critically depend on this kind of rhythmic musical expression. And that's one of the ways that we connect directly with others, including our kids. Now, there are some others who hypothesize that the evolution of music is really just what you'd call auditory cheesecake, meaning that it's just a random byproduct, that it wasn't actually for any big purpose, but maybe it co-evolved with other things that were more important. I think that's probably not true. And I love cheesecake, so I don't think we should minimize cheesecake, even if it comes about in that way. Some have emphasized these 7 components. The social impact of music can be summed up in these points as number 1, the social contact that we get, 2, the social cognition, the way that we enjoy the elements of the music that speak to us. There are both meanings and emotions that are conveyed through music, and we can often agree upon what those communications mean. There's what's called co-pathy, the kind of trust that we have through music, the conflict resolution. And boy, could we really use that nowadays, right? Given our current political situation. And then the processes of communication, coordination, cooperation, and cohesion, all of these elements are critically supported by music. And I hope that these are some of the things that you'll get out of the music that you're about to enjoy today. So with that, let me thank you for listening. I'd like to thank Michael Tenenbaum, who actually endowed a chair for me to study creativity in the arts, the National Endowment for the Arts, the John Templeton Foundation, who supported some of our work. The National Institutes of Health have supported a lot of our other work that's connected to this. And I hope that you may soon try the Arts Impact Measurement System, something we're developing with the National Endowment for the Arts as part of our research lab, so you can convey to us and to the world how music has impacted your own emotional expression and how you feel about the music. So with that, enjoy.
Rick Rosenthal is an award-winning producer and director whose dynamic career has spanned over 40 years in film and television. He's committed to helping launch new filmmakers with a focus on mentoring and supporting young directors and filmmakers in the world of independent filmmaking.
I'm Rick Rosenthal, and I'm very glad to be here today. I'm actually very glad to be here, period, because I am the recipient of a kidney transplant done 2.5 years ago. And through the amazing care of Nilu and the entire nephrology team at UCLA and my amazing donor, I am an incredible success story and have had a new lease on life, which allows me to play tennis almost every day and continue my life as a filmmaker, artist, mentor, parent, and grandparent. So I'm amazingly grateful, and that's part of the reason I'm here today. The other part of the reason is my wife told me to be, and I do pretty much what she tells me to do, especially during the coronavirus. So I'd like to introduce my better half, Nancy Stevens.
Nancy Stevens is an American actor who has starred in many films and television shows. She's an advocate for the environment and serves on the board of the Union of Concerned Scientists and advocates for her other passion, the arts as daily nutrition for all citizens, as a board member of Americans for the Arts.
Rick and I are delighted to lend our voices to Dr. Nilu Nobak's and UCLA Kidney Awareness Program. Kidney disease is a chronic silent disease that the public needs to be more aware of and aware of its devastating health effects. And of course, near and dear to my heart is Nilu's belief that the integration of the music and arts is so important to health and well-being. And in this time in the pandemic, it's so important for people to feed their souls. Last year, when we were all at Schoenberg Hall and had the incredible music of Safa on that piano, we were all uplifted. And this year, because there was no place that we could play, we were lucky enough to have Safa play on my piano in our living room, which was just a thrill. So we're delighted to be here, and we will continue to support this incredible program.
The next piece we'll hear was composed by Alexander Scriabin. This is one of the most challenging pieces among solo piano as far as technique is concerned. Dr. Anjay Rastogi is a professor of medicine and clinical chief of nephrology at UCLA. A second-generation physician, he founded the Core Kidney Program at UCLA to provide the best care with the values of clinical excellence, outreach, research, and education. He's deeply involved in outreach and education. He'll tell us about the focus of Core Kidney to incorporate mindfulness and music in the overall care plan of patients' well-being.
It is my true privilege and honor to be a part of this musical event being organized by Dr. Nilofer Nobak, the director of the UCLA Core Kidney Music Program, and our very talented team. I participated in a similar event organized by her in 2018, and it was quite spectacular. And I have no doubt that you will thoroughly enjoy this one as well. The Core Kidney has always believed in providing true comprehensive care to our patients and their loved ones. This includes not only the medical care we are trained to provide as healthcare providers, but also looking after the overall well being of the patient and their loved ones. This is achieved via multiple pathways, including but not limited to meditation, mindfulness, eating healthy, exercising, pet therapy, and of course, music. Music is a vital part of our daily lives. It not only provides relaxation, but is also a motivator and brings our spirits up. This is all the more important during this pandemic. I want to thank Dr. Novak and our Core Kidney Music team once again to organizing this event. And I truly hope you enjoy it. Thank you very much.
It's my pleasure now to introduce Dr. Helen Lavrotsky. Dr. Helen Lavrotsky is a professor of psychiatry, biobehavioral sciences at UCLA, a distinguished investigator with several publications and prestigious research awards, fellow of the American Psychiatric Association, and the director of the Late Life Mood, Stress, and Wellness Program, and the Integrative Psychiatric Clinic at Terry Samuel Institute for Neuroscience and Human Behavior.
Thank you very much for inviting me to speak to your audiences about the role of music and health, brain health, mind health, physical health. I am a psychiatrist at UCLA studying the effects of music and chanting meditation, particularly on health in stressed caregivers and in older adults with depression and cognitive impairment. And so over the years, I and many other investigators have documented health effects of music. And you could just listen to the music, you could play an instrument, you could sing. It would have a distinct effect on your health. The health effects that have been documented are on overall well-being and the effects on brain neuroplastic effects. That means that brain develops as you're listening to the music or playing an instrument. In children who are playing instruments, it contributes to IQ, higher IQ than in those who don't play instruments. The type of music doesn't really matter as long as you enjoy. And that's how your well-being and the resilience are increased. There's a sense of enjoyment, joy. It also lowers your blood pressure and it reduces inflammation in the body. And those effects have been documented. The National Institutes of Health are very interested in the intersection of music and brain development. And there are multiple grants that are being funded and researched on the effects of music on brain development in younger children and then in older adults and so forth. As far as music for those who have kidney problems, well, you know, besides improving well-being and reducing inflammation, it could also reduce anxiety and depression that are very common in patients with chronic kidney disease. And that's important because the quality of life really matters. It's not just whether you live longer, but how you live your lives and the quality of your life. And that's where music really can contribute. Thank you.
It's my honor to introduce Dr. Suzanne Hanser, a distinguished guest speaker, professor, and chair emerita of the Music Therapy Department at Berklee College of Music. Dr. Hanser was named by the Boston Globe as one of only 11 Bostonians changing the world. She's the recipient of a National Research Service Award from NIA, the Sage Publications Prize, and the American Music Therapy Association's Lifetime Achievement Award. She's the author of the New Music Therapist's Handbook and co-author of Manage Your Stress and Pain with Dr. Suzanne Mandel, and integrative health through music therapy, accompanying the journey from illness to wellness. She's the president of the International Association for Music and Medicine and has kindly agreed to speak with us about the scientific basis for music therapy.
I like to introduce myself through music, and I have my Native American flute that I'd like to just improvise on for you. And as I do, I invite you to close your eyes. And as you listen, let the music take you to a beautiful place in your mind's eye. It could be somewhere you've been, somewhere you love, or maybe even something in your imagination. So I hope you enjoy this little improvisation. Again, feel free to close your eyes. Take a nice deep breath. Fill yourself with life-affirming air. Exhale anything you don't need right now. Whew. Music affects us in so many ways. And I'd like to share with you the ways in which our brain is involved. So when we experience music, there's so much happening neurologically. Processing auditory association starts in the superior temporal gyrus. And internally, the prefrontal cortex is activated, and through the amygdala, the insula is also active. And this is where the autonomic nervous system is processing music's soothing effects, its flow and awe, and even that sense of homeostasis or balance that we experience sometimes while listening to music. I'd like to point out one of the important pathways that happens when we process music. Again, we analyze the music. It starts in the prefrontal cortex. And from there, it goes to the ventral tegmental area, activating reward circuitry. The nucleus accumbens signals that reward, and then the anterior cingulate cortex is implicated with empathy and emotion and decision-making. From there, the thalamus relays information to other areas of the brain and body, simulating physiological, psychological responses of all kinds. The arcuate fasciculus tract, linking visuospatial and language processing, is likewise active with musical associations. So these complex systems make it possible to make meaning of music and to have music make meaning of life. And many patients who are undergoing dialysis or pre or post-surgery may enjoy listening to music to focus their attention on something beautiful. But music therapy is something more. It's actually the systematic use of music interventions by a qualified practitioner in the United States that's a board-certified music therapist. And here you see a study by Madsen and Silverman, who sang patients meaningful music, matched their mood with their own preferred music, and supported the patient's interests and interactions with counseling interventions. They found positive outcomes on all the things you see there: relaxation, anxiety, pain perception, and even nausea. And here, in a study in renal failure, Kentikin and Tan reported reduced anxiety and stress responses in individuals undergoing hemodialysis. In research published in Kidney International, we see here Hedayati and her colleagues. they found that music-based interventions were capable of decreasing levels of depression in people with chronic conditions, kidney and renal disease. And Getty, a music therapist, used active musical engagement, singing, playing instruments, talking about music, moving to music as a means of what she calls emotional approach coping. This is the expression, awareness, acknowledgement, and understanding of emotions as a means for coping with stress, an important underlying model for what music therapists can do. So I hope that here you have witnessed some of the ways in which music interventions, particularly by a trained music therapist, can transform the experience of illness and suffering into joy and meaning. Thank you very much for listening.
Danny Boy is a ballad written in 1913 in England and set to the traditional Irish melody, Londonderry Air. The tune is very popular, thus numerous arrangements from different composers can be found. Many beloved singers have performed this song, including Johnny Cash, Elvis Presley, Willie Nelson, and Andrea Bocelli. Here's a rendition of Danny Boy for cello and the piano, performed by our talented guest cellist, Ideen, who will join Safa. Ms. Cristina Lopez is the manager of the Core Kidney Program. In addition to raising 7 wonderful children of her own, for over a decade, she has dedicated herself to the success of Core. She's the chief organizer of the annual UCLA Kidney Health Fairs, seminars, webinars, symposiums, and all kidney outreach and education events. She helps increase awareness for the Spanish-speaking community as well. Christina believes that music is a necessity for all. She has made sure to instill the value of music in all her children. One of her sons, Gallo, who currently attends UCLA, has a deep passion for music and can be found enjoying playing his trumpet and singing for the public here at UCLA during this unprecedented pandemic.
Thank you, Miriam, and thank you all for being here today. The word pandemic was chosen as the 2020 word of the year by 2 major dictionaries. This global pandemic has changed everyone's lives in many different ways. The pandemic has amplified how important all of our essential workers really are, that we all need each other in so many ways. We have to enjoy the present moment and be grateful for the small gestures that have a huge impact on our well-being. We have learned so many things this year that we will never forget 2020. Music is a healing power in many ways because it brings us together. When the quarantine started in March, my son Gallo, who is a UCLA student, started playing his trumpet and singing from the rooftop of his apartment for fellow students, UCLA Ronald Reagan and Children's Hospital. Music has brought strength, faith, and hope to many throughout UCLA. They now call him Trumpet Man. He will continue to play every night until we are all clear from the pandemic. I hope you enjoy this program that's coming to you virtual. It's our new music program, and we hope you enjoy today. Thank you.
And now we are going to hear from Dr. Ehsan Nobakh, who is a kidney doctor and has been playing music for many years.
Hello, I am Ehsan, a kidney physician. I started playing tar, which is a traditional Persian musical instrument, since I was a teenager. As a nephrologist, I was very impressed when I learned great physicians such as Jacob Henle, for whom the loop of Henle in nephron is named, were great musicians as well, who explored the harmony of nephron as the functional unit of the kidney. Since centuries ago, the melodies performed with tar were used for health conditions such as headache, insomnia, and melancholy, and even muscle spasms. Listening to tar was believed to induce a quiet and philosophical mood, compelling the listener to reflect upon life. I would like to thank the organizer of this wonderful event to raise awareness about the health implications of music during this pandemic. Thank you.
I want to thank you all for joining us to bring the wellness. And a big thank you to our host, Mrs. Mariam Imani. I wish to see you all next event when pandemic is over at a music hall.
We hope you've enjoyed this bridge of medicine and music. We look forward to incorporating your feedback into our next program and ask that you please share your thoughts with us. We will end this program with Safa's performance of Nocturne number 20 in C sharp minor, which he has lovingly dedicated to all the selfless healthcare providers and frontliners during this COVID-19 pandemic.